sonographies, we are going to discuss about this, that how many sonographies are actually needed in the whole pregnancy. Now, everyone have their own protocols. Some believe in having a sonography every month. Whereas, according to the Government of India rules and according to the this FOXI rules, which we follow usually, 4 to 5 sonographies are needed, mandatory. The first sonography has to be done to confirm the viability of the baby. So that is when we need to confirm whether the baby embryo has started growing, whether the heart is beating, and whether the location is proper. Like we discussed about ectopic pregnancy.
Yes, ma'am.
Pregnancy is very dangerous, so we need to confirm the location, the size, the duration, and the viability, whether life is there in that growing embryo. This sonography is done like whenever we need to confirm the pregnancy. Then next comes the NT scan, which is at the end of the 3rd month, around like 11th week till 14th week. So it's in the middle of that. So roughly 12th week we do the NT scan. This we check for some early anomalies. So if there are some defects, we can think about terminating the pregnancy or continuing that with vigilance and all. The next pregnancy comes, which is also called as the bigger sonography or the 5th month sonography. That is usually done in between your 19th and 20th week.
Okay.
So, also one thing everyone has to note is that according to the rules set by the Government of India, rules and laws, we are not allowed to terminate a pregnancy for any kind of issue, any related for anomalies, for any complications, when the pregnancy crosses 20 weeks.
Okay.
So, till 20 weeks, we can again rethink about it and think of abortion if there's some problem or health issues are there. But after that, it is not allowed. That you need to take permissions from the court, you need to take permissions from the higher authorities and all. It's very cumbersome. So we want everything to be confirmed before 20th week, and that is called as the anomaly scan or the malformation scan or level 2 scan.
Okay, ma'am.
Then after that, like we see structurally, we see everything. We see whether structurally everything is there in its proper place, in its proper size and everything. But the function of important organs like heart, echo, 2D echo, what we do is fetal 2D echo, has to be done around 21, 22, 23 weeks. So that will give you the function of the heart, whether the heart is properly functioning. Comes the growth scan at around 28 to 30 weeks, which growth, the amount of water, the cord, then these things are seen, whether the position has changed and all. And then the last sonography is in the at the end of the 8th and 9th month. So that is when we do color Doppler, the blood flow and everything. We see again, we confirm whether the patient is fit enough to have a normal delivery or he should go for a cesarean section. So that is when we decide. Like 90% of the decision takes place only at the end of 9th month. And then this question of asking whether the patient is going to have a normal delivery in the first visit itself, completely wrong, because no
you cannot predict actually.
Never we cannot predict it. Any obstetrician in this world cannot predict whether the baby will be coming through the normal way or this is and it is only when we say that it's a normal delivery when the baby is in our hand. But till it's accomplished, we cannot call it as a normal delivery. So it again depends on all these things. So 4 sonographies or 5 sonographies are a must. First, to confirm viability. Second is the NT scan, anomaly scan, growth scan, and the last sonography. So 5 are completely essential. You can again skip the NT scan if you like there's affordability issues and all these. Skip the NT scan. But all these 4 scans are again very important.
Very important.
And again, yes, and again now, like since more and more high risk pregnancies are conducted these days. There are so many IVF pregnancies.
Yes,
There are
ma'am.
many issues, complications.
Hmm.
So, and in some cases, we need to follow up these sonographies. Like every month, we need to follow them up. So then
Okay.
the number may go up to 6 or 7 sonographies also.
Okay.